Hello everyone, myself Dr. Ayush Gupta. This is the part 3 of my series on rapid fire anesthesia. Here we will be discussing about instruments in anesthesia. This is a very important part. The first topic here is about laryngeal mask airways. The first image shown here is known as LMA Classic. This has a single tube which is known as airway tube. This is non-reusable. The second one is LMA Supreme. It has one airway tube and one gastric tube. This gastric tube is used to put the rise tube. All the LMAs with gastric tube are known as second generation LMA. This is also non-reusable. The third LMA here is known as fast track LMA. Also known as intubating LMA. This is made of silicone, therefore can be reused up to 40 times. It is sterilized by autoclaving. It has a pilot balloon attached. It also has a handle, which is an identification feature for LMA fast track. The fourth LMA is known as iGel LMA. It is made up of thermoelastic polymer. It does not this iGel LMA do not have a pilot balloon because this thermoelastic polymer expands with human body temperature. The fifth LMA is LMA Crucial. It also have a pilot balloon and can be reused. It also have gastric tube and airway tube. Therefore, it is a second generation LMA. It is the most common LMA used in daycare surgery. Next, we are going to see the steps of intubation. The position of intubation is known as barking dog position or sniffing the morning air position. The steps include: first, we have to insert the laryngoscope. in right corner of mouth. Then we have to sweep away the tongue from right to left. No matter whether you are right-handed or left-handed, you have to sweep away the tongue from right to left. Then lift the laryngoscope. Once the vocal cords are seen, pass the endotracheal tube inflate the cuff and then check the position. To check the position of endotracheal tube, we can use X-ray or we can auscultate, but the gold standard is end tidal CO2 measurement, also known as capnography. Next, we are going to see about the laryngoscopes. The laryngoscope with a curved plate is known as Macintosh laryngoscope. It is used in adults. The laryngoscope with a curved plate and handle is known as McCoy laryngoscope. The laryngoscope with a straight blade is known as Miller's laryngoscope. It is used in children. The McCoy laryngoscope is used in difficult airways. Next, we are going to see about endotracheal tubes. This is the cuffed endotracheal tube, and this is uncuffed endotracheal tube, generally used in children to prevent subglottic stenosis. The endotracheal tube has an opening at the end which is known as Murphy's eye. The use of this Murphy's eye is when the end of this endotracheal tube is blocked, the ventilation is possible through this Murphy's eye. Next is the North Pole endotracheal tube. and this is the south pole endotracheal tube. The north pole endotracheal tube is used for any mandibular surgery or neck surgery, but the south pole endotracheal tube is used for any maxillary surgery to provide a clear view to the surgeon. Next is double lumen endotracheal tube. This is used in thoracic surgery for one lung ventilation. Next is the armored endotracheal tube, also known as flexometallic tube. It is resistant to tear. Next topic is for airway adjuncts. The first image is for Goodell's airway. It is used to open the airway and can also be used as a bite block during seizures. For the size of this Goodell's airway, we have to measure the distance between the lips and angle of mandible. The next image is of nasopharyngeal airway. The length of nasopharyngeal airway is the distance between tip of nose and ear lobe. Next is stylet, and this one is bougie. The use of both stylet and bougie is to guide the endotracheal tube during difficult airway. Next, we are going to see the types of circuits. There are three types of circuits, namely open circuits, closed circuits, and Mapleson circuit. The open circuit is known as rebreathing circuit. The exhaled air in open circuit is not recycled. The closed circuit is known as non-rebreathing circuit. It is the most commonly used, and the exhaled air is recycled. The third one is Mapleson circuit, also known as semi-closed circuit. There are 6 types of Mapleson circuits, out of which only 3 are important. The first one is Mapleson A, also known as Meigel circuit. It is used for spontaneous ventilation in adults. The second one is Mapleson D circuit, also known as Bain circuit. It is used for controlled ventilation in adults. The third one is Mapleson F circuit, also known as Jackson Rees circuit. It is used for spontaneous and controlled ventilation in children. Next, we are going to see about the oxygen delivery devices. The first one is simple face mask known as Hudson mask. The maximum oxygen which could be given by Hudson mask is 10 liters per minute with a FiO2 of 60%. The next is nasal prongs, also known as nasal cannula. It can provide oxygen maximum up to 5 liters per minute with an FiO2 of 40%. The next is Venturi mask. It can provide the FiO2 of 24 to maximum of 66%. The maximum FiO2 is of green color Venturi and the minimum FiO2 is of blue color Venturi. The next is AMBO bag. The full form of AMBO is Artificial Manual Breathing Unit. It can provide the maximum FiO2 of 100%. The next is non-rebreathing mask. It can provide maximum FiO2 of 80%. The next is high flow nasal cannula. It can provide the maximum FiO2 of 100% and oxygen at a rate of 60 liters per minute. The next is non-invasive ventilation. It can also provide 100% FiO2 with a maximum oxygen of infinite liters per minute. Next, we are going to see about the needles. There are 3 types of needles: Quincke's needle, Whitcare needle, and Sprotte needle. The Quincke's needle is the most commonly used. It is a traumatic needle, while the Whitcare and Sprotte are atraumatic needles. This is the epidural needle. known as two-hoist needle. This two-hoist needle has two wings for support and a needle has black marking. This is the identification point. Next is pulse oximeter. It is used to find out the oxygen saturation. The only point you want to remember about the pulse oximeter is that it is based on Beer-Lambert's law. This was all for this video. Please like, subscribe and share it with your friends, and stay tuned for the part 4. Thank you.